So I wrote this book for everyone. There was a hunger, I think, to find out where we are in the history of cancer, how did we get here, and what happens next. So this book, it was my attempt to try to understand that story, to try to explain that story to myself actually first, and then to my patients, and then ultimately to everyone. Well, there are many promising elements for the future. I mean, I think that we're at a really pivotal point in the history of cancer, where we have one of the deepest understandings in history of what the fundamental series of abnormalities in cancer is or are. The question right now is, can that understanding be converted into real medicines, into real treatment paradigms? Well, I could tell you a little bit about some particular cancers. As you know, in the Western world, the diagnosis of cancer is increasing dramatically. Between 1 in 3 and 1 in 2 men and women will be diagnosed with cancer during their lifetimes. But thankfully, survivorship from some cancers, not all cancers, is also changing. The best example probably is breast cancer. So breast cancer, the mortality of breast cancer has decreased by about 1% every year in the Western world for the last 20 odd years. Now you might say 1% is not very large, but over the course of 20 odd years, that has amounted to about a 20% decrease in breast cancer mortality. And that's a very significant impact. Other cancers, have been very difficult. Pancreatic cancer has really not changed in the way we really haven't changed very much in the way we treat pancreatic cancer for decades, although now there are new medicines finally coming out and new preventative mechanisms coming out for pancreatic cancer as well. Simplest explanation is that cancers are a distorted version of stem cells. Stem cells have a capacity to renew themselves, and cancer has a capacity to renew itself. So the questions that we ask are questions like, what are the parallels then between the renewal of cancer cells and the renewal of stem cells? And can you exploit this understanding? Can you, based on your understanding of stem cells, can you find new treatments for cancers? And in particular, we focus on blood cancer because blood stem cells are the best understood of all stem cells.